Hello, everyone, and welcome to our webinar, where we will focus on interfascial plane blocks for ambulatory surgery. Advancement of ultrasound techniques in regional anesthesia and emphasis on multimodal analgesia for enhanced recovery after surgery has led to the rapid development of various interfascial plane blocks in the past decade. Our goal tonight is to discuss what is currently known about these various blocks and what role they have in the ambulatory surgical setting. For those of you who are not SAMBA members, please consider joining the society as it offers many benefits to members. You can view a list of membership benefits on your screen now. Please visit our website, www.sambahq.org, to learn more about the benefits of membership. A few quick housekeeping notes before we get to today's presentation. Please note that this webinar is a listen-only mode. As an attendee, your audio and video is off. On the bottom of your screen, you will see two buttons, one that says chat and one that says Q&A. Please use the chat function to chat with other attendees during the webinar. Please use the Q&A box to place any questions that you have for our presenter. Dedicated time for questions and answers will take place at the end of the presentation, but please submit your questions throughout the talk. SAMBA is also on Twitter, Facebook, and LinkedIn. Connect with us on social media to stay up to date with all things SAMBA. Now, on to our introductions. My name is Sylvia Wilson. I am a professor in the Department of Anesthesia and Perioperative Medicine at the Medical University of South Carolina, where I also serve as Division Chief for our Regional Anesthesia, the Director of our Regional Anesthesia Fellowship Program, and the Jerry G. Reeves Endowed Chair for Research. I will serve as your moderator this evening and look forward to your questions and comments. At this time, I would like to introduce tonight's presenter. Tonight we welcome Dr. Chang Park. Dr. Park is an assistant professor for the Department of Anesthesiology and Perioperative Pain Medicine at the Icahn School of Medicine at Mount Sinai. After completing his residency training in anesthesiology and his fellowship in regional anesthesiology at Mount Sinai Hospital, he stayed on as a faculty member with a specialized clinical and research focus in regional anesthesiology and simulation education. In the past, he has been invited to teach at various ultrasound-guided regional anesthesia and point-of-care ultrasound workshops. And tonight, he will update us on interfascial plane blocks for ambulatory surgery. I will now turn things over to you, Dr. Park.
Thank you so much for the introduction, Sylvia. Let me just put up my slides here. Okay. So hello, everyone. It is an honor to be here today to speak to you about interfascial plane blocks. It's been interesting for me to see the progression of these blocks and see how their use has exploded in the past decade. It's really felt like every year a new block becomes popular and we incorporate it into our various surgeries. And then another block comes out soon after that and the cycle repeats itself. Once you become adept at one of these blocks, it's easy enough to apply your ability to another block and become quite good at a group of them. But for myself, I've noticed that the more I learned about these blocks in order to perform them, the more questions arose in my head. So my goal for today isn't to focus on the how-to for these blocks, but rather go back to the basics a little bit and talk about the foundations of interfascial plane blocks and the evidence behind them. So the objectives of this webinar are the following: provide an update of the current understanding of how interfascial plane blocks work, describe the relevant anatomy of common interfascial plane blocks. This is by no means an exhaustive list, but they are the ones that are more widely incorporated into our practice and have a growing body of